Hello, everybody. My name is Tashina Mashane, and I work with the Indians into Medicine program at the University of Arizona, and I am currently the outreach coordinator for the program. This presentation will actually help you to, as a high school student, understand a little bit more of the differences between health professions and how you can prepare yourself in pursuit of a health profession through higher education and on into your professional career. So here is my presentation. Okay, exploring health careers. How do I become a health professional? And many individuals can think like, where do I start? High school is actually the best time to start looking into considering a health profession and knowing the different resources that you can have access to, whether it be in high school or volunteering, as well as on into higher education. So here are just a few facts and figures on the demographics that we have for professionals who identify as Native American. 38% of American Indian medical students actually plan to work in rural and underserved areas, which you know is very, very important. A few facts and figures. Due to a 2016 study, there were over 53,000 students who actually applied to medical school. A little bit over 500 of those students actually identified as Native American or American Indian. And out of that over 500, just under 200 students were actually accepted to medical school, but yet 3 out of 5 students who were questioned in a survey of their after college aspirations identified that they wanted to go into a health professional career. So we're talking about how do you start in high school? Here are a few ways. You can start now. A lot of people think like, oh, well, I just wait until I get into college to start considering it, but the best time is to start now. Start researching the different types of health professions that you might be interested in. If there is one that interests you more than another, write it down, do your research. It's always a good time to meet with your high school counselor and ask those necessary questions on what types of mathematics you're gonna have to take, what types of sciences you need to satisfy in high school. So one of the things I always tell students is do well in your sciences and maths, pay attention, because medical schools, once you get to college, those are the core courses that you're going to have to do well in to be a competitive applicant. So it's always best to start in high school and have a good understanding. Getting involved in the health world. As high school students, you have the opportunity to get to know different organizations within the health world, where it's veterinary sciences, pediatrics, EMTs. They have organizations that put on conferences. They have individual summer programs that you can learn about and get applied to in high school. Take advantage of opportunities that come your way. So a lot of high schools will talk about volunteering, getting involved, being part of a shadowing program. Always try to say yes to at least one of these or 2 of these in high school so you have a strong foundation of leadership, exposure to professionalism, and learn how to advocate for yourself to better yourself in the future. And of course, with those opportunities can develop strong leadership skills where you're sharing what you've learned in a professional setting and really applying it to your life to create a sense of leadership for yourself. You can also translate this onto your resume, which you will learn how to do either in high school that will develop and follow you throughout your high school education, higher education, and on into your professionalism. So I always talk about it's very important to make sure that you are researching the types of health professions that are out there, because you really want to distinguish how much time you actually want to spend in school getting the necessary education to become a health professional. And some take longer than others. So it's always good to do that research and really find what will work for you. But always remember, these can change in the future. A good website that I like to utilize is exploringhealthcareers.org. It'll give you like a test, like what kind of health professional, based on your characteristic skills, what you would be good at. So utilize this website. You can click on it and research it yourself. It also gives you a definition of a variety of health professions that you can use in your research to figure out exactly what you want to do. It'll tell you what kind of environment you're going to be working in, how much schooling it takes, what kind of scholarships are offered, and also how much you're going to be making. So we like to divide our health professions just so for a little bit better understanding. Allied health professions versus professional health professional schools. So of course, allied health professions take a little bit less time. You can do these, get into these health professions through a community college, through a 2-year program. Some of them take longer. It all depends on the school's curriculum. So like dental assistant can take up to 2 years to complete at a community college. They also have individualized course planning. So you can go into becoming a dental assistant at a school. You can do it at a clinic. You can do it in like a surgical unit. So it has all different variations. EMTs, which is emergency medical technologists, those ones come with, you can do at community college also, and also have a short time frame of education that you have to spend in an actual school setting. And they're really good because they're really hands-on in the community college level. Now for our health professional schools, these usually entail having to have a bachelor's, so that's 4 years of education, going on to graduate school or going into medical school, which can take up to an additional 4 years, 6 years for professionalism. So they average, I want to say, around about 12 years from going into either community college or university on up to when you actually get your professional degree. So like medical doctors, surgeons, pediatricians, all of these are going to be specialized. So you would have to go to a particular school where you get rotations and start those hands-on experiences. So I always like to say you can always start in the allied health professions, which will really, really help you, and then move on to a health professional school. So in high school, you have to make sure that you're talking to your college counselor. Some students meet with their college counselors maybe like once or twice a year. It would be good to start at least 4 times a year just to talk to make sure you're on the right track. If there's any opportunity classes, taking AP classes that you can talk to your counselor about and see if those are even a training class for something that might be outside of a health profession that you might be interested in. They are the ones who will help you guide through your academics. College counselors also have opportunities to share what type, if you tell them what type of college you want to go to, they can sort of cater your classes to fit the need of that certain community college or university. And like I iterated earlier, chemistry, biology, physics, calculus, algebra, and geometry are core classes that you will take in high school. You will also have these same courses most likely in college, your first 4 years of college, whether it be at a community college or a university. You would be taking a little bit more advanced courses of these. So it's really good to have an understanding in high school and early on. So I like to say, be a little extra. So you can talk to your college counselor in high school and ask, are there any local community colleges or colleges within your area that are offering additional courses to high school students? So this can be like medical terminology, CNA courses, emergency services, public health, health and behavioral sciences. We've experienced a lot of some students that actually took these extra classes, and then once they graduated from high school, they actually had an associate's in a different category. So when you turn 18 years old, you would be able to qualify to take a board exam, or not a board exam, but like a certificate exam to actually start work right outside if you had these extra courses. But the medical terminology, all these courses will help you just get a little bit ahead in your health professions pursuit. They do offer them, so talk to your college counselor. And what we talked about, of course, is a dual degree at a community college. Dual degree means that you are enrolled in high school as well as a community college setting where you can get an additional certificate once you complete high school or when you transfer over to the community college. These are always really good to look into, talking to other individuals who want to just get ahead or have a better understanding of a health profession that they see fit for themselves. And here are just a little few associations that I wanted to point out that actually cater towards high school students. They have conferences, scholarship opportunities, traveling opportunities, internships for high school students, and you can create a network for yourself to have, to meet with other students who have the same aspirations as you. So going into community colleges together can help. Hey, you're in high school, I'm in high school, we both want to be health professionals. So it creates that network for students. And a lot of these are catering to our Native American population that have the aspiration to continue and go on to a health profession. So just taking advantage of those opportunities that come your way, attending conferences like HOSA or ACES, like we're talking about right now. Your area health education centers are in every state, and they have opportunities for you to learn more about health careers, and might even have volunteering opportunities, just like I listed here. But always take into consideration volunteer opportunities that are outside of a health profession. So like summer camp counselor, looking into those different opportunities, whether it be a summer job, becoming an assistant sports trainer for your school. Always ask. Worst thing they can say is, no, we're not taking anybody, but you still have an interest because those opportunities can come up. And then let me move myself out of the way over here. For those summer experiences that you can take advantage of course, summer programs, University of Arizona has a lot of different summer programs that take place during our summer months. So May through August, where you can get hands-on experience learning about various health professions. Future Health Leaders Camp, MedStart, Farm Camp, Scrubs Camp, all of these ones are at the University of Arizona and run every year for students who have an interest in a health profession. But always go to at least one summer experience, whether it's educational, whether it's a sports activity. It really helps your character and builds yourself up for the future when you want to go to either higher education in the future. Okay, and always be sure to, I'm just gonna go through this one, develop your skills and resume. Always have something on hand, whether it is writing down your experiences, maybe you wanna write down an instructor who has helped you through it, for source of reference, getting their contact information so that they can help you on your pursuit also. Oops. So always look as a way to document what you've done, and attend workshops, attend different events. Right now we're in a virtual world, so it's great if you have the ability to attend different workshops that are coming to you virtually, and hone in those skills during this time. And of course, always think about why you want to consider the colleges you go to. If you want to go to community college first, I am a strong advocate for going to community college first. One, it's cheaper, class sizes are small. If that is what you need in your academic career, there is no shame in going to community college first, transferring over to university, or even doing both at the same time. A lot of our students were enrolled at the University of Arizona, but also took to community colleges classes because it was, once, cheaper, and two, the classes were smaller, so you had more time with your instructor. And always find out if your courses transfer. It's always pivotal. So if you are taking those dual classes in high school, make sure that they transfer to the college or university that you want to go to. And then know exactly what is your education going to cost. This can be a hard question for some people. Even when you are really motivated, sometimes knowing how much it's going to cost can better set you up in the future. Starting out at community college first, getting your associates, and then being a very, very strong candidate in college and university levels is pivotal. And always make sure that the college that you want to go into has your program of study or something similar that you want to pursue. If you want to go into physical therapy, if you want to see if they actually have a physical therapy program or something similar, like the University of Arizona, they have a pre-physiology college, which is really awesome, which is along the lines for setting you up well for physical therapy. So always make sure that your college of choice has your program of study that you're interested, but always remember that you can start out as a non-degree seeking student and sort of navigate your own way. But I always have to say, always do well. If you want to pursue a health profession, make sure that you're doing well in your sciences and mathematics, because that's what they want to look at. So Arizona Indians into Medicine, we help high school students navigate their way through higher education, like I'm doing with this presentation. Undergraduate students, we help them sort of transition into the role of a higher educational student. We put on workshops that help students get a better understanding of what it's like to take an MCAT, to take one of those tests that you have to do to get into a health professional school. We have pre-advising. So as a college student, you can go to one of our organizers and actually ask, what classes do I need to take to better set myself up for a health profession? And then for graduate students, we help for mentorship, recruiting for nursing, pharmacy, public health, and medicine. We always know our students at some point might even just change their aspirations to be, if they want to go into public health and all of a sudden, you know what, I want to go into medicine. We help those students to navigate that way and make those transitions and develop their interests in health. Medical students, we assist with the providing of resources to rural health. So if we have different workshops in rural communities where students need to get some hands-on experience, we'll oftentimes help our students pursue those, let them know, hey, this is going on. Maybe you'd be interested in getting some experience in this field. So now this is really important, talking about adapting to COVID-19, free conferences and summer programs. A lot of the programs that you would initially go to in person and experience are going online, and many of them are offering it for free because, you know, it takes away having to pay for meals, it has taking away having to pay for lodging. So they are able to give free conferences and free summer programs. Yes, you will be have to be in a screen like this, but it's such a beneficial because you get to learn and hear from actual health professionals, get course credit for some of them. So look into those. Volunteering, a lot of people, for example, have been making a lot of masks. So maybe you want to make masks or distribute goods like they are on the Navajo Nation right now. Hone into your unique experiences and talk about how has COVID affected you? How has the transitions in your education, in your home life, how has that changed? And talk about it. Have those open conversations, of course, about, because we are not the only ones in the course of going virtual in the pandemic. So have open conversations with your family, with your colleagues, with your friends. And then free tuition rates. Some colleges, like giving example, Tanatham Community College in Sells, Arizona, which is a tribal college, is offering free tuition for the summer as well as the fall semester. So you can actually take courses while you're still in high school and sort of get ahead a little bit. Cultural alternatives. So a lot of course, we have to go virtual. There's a lot of different insight on how to adapt your mental health. Take advantage of those. And then public health advances. Of course, everything in our community is about public health right now, washing your hands, being safe, education about COVID, and other public health initiatives. So you're learning about that, but you can also develop some in your household. Maybe you can work with your family and say, you know what, public health says wash your hands. Teach your nieces and nephews about those things. And that's how you can adapt and still give light to our situations that we're going through right now. But we hope that you still have aspirations to pursue a health profession, and University of Arizona Indians into Medicine can definitely help you. Okay, so thank you so much for attending my, or clicking on this link and hearing my presentation. If you have any questions, please feel free to look at resources. Again, my name is Tashina Mashane, and I'm the Outreach Coordinator for Arizona Indians into Medicine. Thank you.